Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program where we explore the world of health, innovation, and modern medicine. Today, we focus on one of the most vital structures in the human body, the spine. It supports us, moves us, and protects our nervous system, yet it's also one of the most common sources of pain and disabilities in modern life. From poor posture to long sitting hours, back and neck pain have become part of daily conversations, often ignored until they become serious. And when surgery is mentioned, many patients hesitate, worried about risks and recovery. Tonight, we will separate fact from fear and learn about the real advances in spine care, from conservative treatments to minimally invasive surgeries that restore comfort and confidence. Joining us to discuss this essential topic is Dr. Abdulaziz Alhajeri, a consultant orthopedic and spine surgeon, who will help us understand how modern spine care can truly change lives. Stay tuned. We are watching Medical Talk. Welcome back. We are happy to have with us in the studio Dr. Abdulaziz Alhajeri, a consultant orthopedic and spine surgeon. Dr. Abdulaziz, welcome to Medical Talk.
Thank you. Thank you very much for inviting me to this session.
I have so many questions for you.
You're most welcome. You're most welcome.
And I know you're tired.
Yes,
I know you just came back from surgery.
Thank you.
Okay, but please bear with me. I want to start with the basics. What are the most common spine problems you see among patients today?
Okay, so in 2025, in this century, with the advancement of medical services and advancement in new medication, you see more of elderly patients. Patients are aging, and we have more of a geriatric population. So mostly related to our spine is basically the osteoporotic fractures and the degenerative spine. Usually they lead to compression of the nerve roots, and then they come with back pain and what's called a sciatica, which is basically a pain radiating from the back all the way to the legs and to the feet, maybe with some weakness, and that necessitates our intervention and attention.
Exactly. So it's mainly that bulk of patients, the age group, that age group.
That's true.
But that, not to mention that it could happen to younger
definitely
generation.
The younger ones are mostly of trauma cases, or could be some congenital or developmental spine deformities. And this is what we're dealing on almost a daily basis. Okay,
we're going to dive deep onto that, but many people complain about neck and lower back pain specifically. What are the main causes behind these issues in today's lifestyle?
It's actually the technology. The technology which leads to sedentary lifestyle, less activity, and then they usually depend on the tablets or the mobile phones, and they what we call it a texting neck, where basically they lean and forward their neck, and then with the time they have the disc herniation and the sequelae of neck pain and the nerve root and weakness, and then that's what we see mostly. And plus this, with the sedentary lifestyle, they have more of a weight gain, the BMI, or what's called the basic mass index increases, and then with the obesity you see them coming with back pain. So that's it. This is actually what's sadly the true, and this is what's happening, what we're seeing on a daily basis.
Combine that with their daily jobs or lifestyle that they do, actually, because I'm going to talk to you about some of the professions that are more prone to spine problem or neck problem. When should a patient see a spine specialist instead of relying on, let's say, painkillers or rest or home therapy?
Thank you very much. This is actually one of the most important points I elaborate with patients. When you have a back pain, you should seek a help of a spine surgeon. You don't go for a general physician. You don't go for a general surgeon, or you don't go for an ophthalmologist. You should seek the attention of a spine surgeon. So many, and because is it the lack of education or awareness, most of the patients, when they have pain, they seek physiotherapy or injections or medication by themselves. But actually, the right treatment starts with the right diagnosis. So you should seek and ask who has a profession in spine surgery, and then based on that, you seek their help.
Exactly. You check that box first, And if it goes well, then you can actually,
Definitely.
The spine surgeon or the spine specialist will guide you where to go.
True.
There's often confusion between disc herniation and slipped disc, basically.
Okay.
Can you explain to our viewers the difference in like simple terms?
Okay, so people are different in their understanding. So slipped disc is almost, the concept itself is understood by people that slipped disc is herniation. To some point it is. So basically between those points, the disc comes out of its place, and whether it compresses the nerve or no, the presentation will happen. If it compresses a nerve, then we have what I call the sciatica if it's low back, and if it's neck, they will have weakness in their hand. So yes, basically slipped head disc is almost the same as a disc herniation.
But that's left to the doctor to decide whether that's...
Definitely, yes.
Okay, I'm not going to even go into how you diagnose this thing. We're going to talk about that later. But what are the non-surgical treatment options currently available, and which cases do they work best on?
60 to 70% of back pains are actually conservative treatment. And that could be physiotherapy, could be injection, could be lifestyle modification or medication. So depending on the presentation, the longevity of the problem, and the location of the problem with the examination, as a spine surgeon, I can guide the patient where to go. And again, I told you, it's 60 to 70% of the cases are conservative.
The reason I asked this question because it's a lead for my next question, which is the minimally invasive spine surgery is gaining so much attention now, especially in the literature. How does this modern technique differ from traditional open, say, major surgery?
Okay, so the concept is almost the same, open and minimal invasive. The difference is it's a smaller wound, less blood loss, but it should give you the same results as an open surgery. But again, I tell you, MIS surgery or minimal invasive is not for everyone. It depends again on the case and the presentation of the patient. Not every patient has or will have the privilege of having a minimal invasive, according to the case.
Okay. With that, it depends on the case. Are there certain contraindications for these procedures?
Yes.
Like?
Okay, so I'll give you an example. If you have a patient who had a fall with what we call, in our language, as spine surgeons, a burst fracture, which is basically complete loss of the architect of the vertebra. You cannot treat that.
You basically shatter the...
Exactly.
Yeah.
You should go in properly, open, wide open, see all the anatomy and try to reconstruct it.
Yeah.
This cannot be done with a minimal invasive.
Yeah.
So there are cases like scoliosis. Scoliosis is a big surgery.
Yeah.
Yes, there are some MIS indication for that, but it has to be a small curve. But if you have a big scoliosis, which is basically a big curve, you cannot correct it with an MIS. You need to open.
What about age?
Age is a good actually indication for minimal invasive.
Okay.
Because you don't want a big wound. The patient is elderly; they cannot tolerate long time of anesthesia. You want to give them some.
Oh, so you prefer it for the older generation, basically.
Yes.
Yeah.
But if the case permits, if it's a small area of compression, you can go minimal invasive, decompress this area, and the patient will be well and good.
So basically, the recovery after the minimum invasive surgery is, I would assume, because it's minimal, should be very fast.
Yes.
Like how fast? I mean, how long should we expect for the patient to be discharged?
So I'll give you an example. A discectomy can be done by minimal invasive.
Yeah.
The patient will do it in the morning, and then by afternoon they can go home.
Same day.
Same day.
Wow.
Yes. This is the beauty of a minimal invasive. If you choose the patient properly.
Exactly.
Yes.
Proper diagnosis, early diagnosis, and carefully choosing your case.
True.
Well, we have so more questions, but we have a short break. We watch a report and we'll be right back. Stay with us. Welcome back. We're still talking in the studio with Dr. Abdulaziz Alhajeri. Dr. Abdulaziz, before the break, we were talking about the minimal intervention for spine surgery. many patients still fear spine surgery, mostly due to the stories of paralysis or complications.
Yes.
What do you say to that?
Sadly, I still encounter such patients almost on a weekly basis, and I tell them the following. Spine surgery in the last 10 to 15 years, it's a humongous and it's a huge advancement. What used to be difficult to be seen, now with the technology, we see it 50 times bigger, meaning the microscope, the endoscope, the robot, the navigation. It's a different era. So the chance of paralysis or paraplegia or quadriplegia, I would say it's less than 1%, easily less than 1%. But still the mentality and the thinking from old stories, God knows, maybe 50 years before, that there was paralysis. Personally, I've never seen such patient who goes in that. But even if I ask the patient, they say, we hear. We hear, but they never saw.
Exactly, and there is not one documented, basically, case that they actually can refer to. I would say especially, at least in our field here in Kuwait, you know, I cannot remember one case. I always try to ask if there is one case that well documented and it's because of like a surgeon fault or something happened.
See, complications could happen. But in the right hands, spine surgery is very, very safe. And the outcome is amazing. I mean, the outcome and the feeling of living painless and enjoying your freedom without any walking aids. It's a different life.
I'm glad that you mentioned about the pain, because I want to talk about the recovery. What does a typical recovery period look like after spine surgery, and what factors help patients return to a normal faster?
Very good question. So number one factor is motivation, patient motivation. If the patient is psychologically and mentally well, they want to live pain-free, right? So this is number one. If they're motivated, you do the right surgery, they can walk on the same day. Either cervical spine or lumbar spine surgery. They can at least stand from bed to the bathroom. They can walk all the way with minimal pain in the right hands.
Do you advise them to move right after the surgery?
I never had a patient who didn't walk after 12 hours. They always walk after 12 hours. It's a must. It's a must.
Because the reason why I ask this is because a lot of the surgeons, general even surgery, doing even any major other surgeries, they always, advise patients to start moving, and walking, because of the, the blood circulation, and it will help the healing, and the water accumulation, the edema, basically in the region. And as you mentioned, nowadays with the infection control system that we have, especially here in Kuwait, which is we are very proud of, and the technology that we have, the machinery that we have, and the know-how, basically, with the expertise. As you mentioned, I think it's very promising, and it should be the recovery very, very quickly and very fast. Now, before all of that, prevention is the key. Okay, so what daily habits, posture corrections, or exercises can protect our spine and reduce future problems?
So first one is weight loss. That's
number one.
Number one. Whatever you do, if the weight is more than 25 on a BMI scale, problems are coming. So weight loss is number one. Move. You have to move, always move. When you have a disc job, 2 hours, after 2 hours, you have to walk at least 45-10 minutes. Circulation. Don't let your joints be stiff. Your muscles will shorten if you stay and put for some time. So I advise them weight loss, move if you have a disc job, and then join a gym, exercise, cardio, Swedish exercises, do some swimming and hydrotherapy. That will promote your circulation, your cardiovascular will be better, and your bone will be stronger. And this is actually one of the strategies in osteoporotic patients, to exercise. The
reason why I asked this question is because whenever we go to the gym, you hear like some people, they say, oh, look, I'm trying to work on my back muscles. I'm trying to strengthen my back muscles. And when you see them lifting weights, basically, sometimes, you know, I know the intention is good, but sometimes it could result in a very bad. So what do you say to people who usually go to the gym and they have a good intention of strengthening their back, but they could do something really, really harmful to their spine?
True. But even when I go to the gym, I see those patients or those people, and I advise them, more repetition, less weight. Don't go with more weight and few repetitions. That will harm you. Go for light weights and then do the repetition. Whatever steps or repeats you want, you can do it. But don't go with high weights, and especially freestyle. When they lift the weight with no back support or leg support, they're gonna have problems. So
do you see, I mean, because we were talking earlier about the age group that we see mostly, you said the elderly. Now, is it a trend? Like sometimes you see younger guys or younger patients who are having back problems because, say, a wrong exercise or they lift the heavy object.
This is true. Yes. Especially bodybuilders, they go with high weights and more repetitions, and with the medications or hormones they take, they're really harming themselves. And then whenever they leave that kind of a sport or the drugs, they're left with their weak body, and their muscles and bones are really weak, and then they're gonna have osteoporosis, fractures at a younger age.
Speaking of medications, in terms of like oral medications that patients they take, mostly it's for pain.
True.
But also there are some muscle relaxants.
True.
Could that mimic a serious problem in the spine itself? If for example, they can take they block the pain or they take muscle relaxants, but the actual structure of the spine, you could have a problem.
Through the medications?
Yeah, I mean, the medication could actually be more harmful, not harmful, but you know, it kind of like blocks
certain yes, like if a patient who has a fracture and they take too much of painkillers, this will prevent bone healing. So this is a negative. You should be balanced between everything. Even when you have a fracture, you shouldn't take painkillers like on an unacceptable rate. You take it in a wise and follow the instructions given by the doctor. Some other medications like gastritis and GERD for the reflux. If you take them for a long time, they lead to osteoporosis. So the dose, timing, and the why is really important, and you follow the doctor's instructions.
And I only ask this question because you mentioned osteoporosis. Do you see this more in like the back spine problems? Or is it more towards females or males, or is it
osteoporosis more? It's like 90% of the cases are females.
Okay.
It's because the hormonal imbalance that happens after menopause. And then actually their hormones are protecting their bones. So when they lose this balance between estrogen and progesterone, the bone becomes weak, and then they're prone for osteoporosis. But again, there is a protocol to prevent this.
Exactly. And finally, doctor, what message would you give to those living with chronic back pain but still afraid to seek medical advice or surgery?
So first thing, seek a spine surgeon whenever you have a problem. Don't go and roam around in other specialties. 2, weight loss, and try to maintain your good balance. Lifestyle, go to the gym, walk around in the malls, just to strengthen your cardiovascular system and be healthy all the time. If you don't know and you have questions, just seek medical advice and you will get the answers.
Dr. Abdulaziz Alhajeri, thank you so much for your time and sharing all this valuable information with us in Medical Talk. And hopefully, we'll be able to host you again in Medical Talk.
Thank you.
Thank you so much.
Thank you.
Dear viewers, we still have more to go. Stay with us. We'll be right back. So, dear viewers, before we go to our family health tips, let's remember that good health always starts at home. When every member of the family cares, we build a stronger, happier home. Health awareness is no longer a choice, it's a need. Knowing how to eat well, sleep well, and move well can protect us and our children for life. Let's now watch our family health tips together.
Hello everyone. Today I'll be talking to you about these big diet myths that we hear, but we're not sure if they're actually real or not. And the first one is that carbs are bad for you. Now, on the contrary, not all carbs are the same, and they're not actually really bad for you. Now, when you're looking at carbs, you have different sources of carbs, and mainly you've got the simple carbs and the complex carbs. Simple carbs are things that come from white bread, white rice. They actually provide no nutritional value. They spike your blood sugar, really give you nothing but calories. But when you're looking at complex carbs, you're looking at carbohydrates that contain fiber in them. They stabilize your blood sugar. They keep you full for a long time. They actually also contain a little bit of protein in them, and they are very beneficial. Now, I know a lot of diets actually, disqualify you or ask you not to have carbohydrates, but carbohydrates are your brain's main source of energy, and you do need them, believe it or not. But you just need to be very mindful of the quantities and where you're getting your carbohydrates from. Fruits and vegetables also count as part of your carbohydrate intake, and they are very important as they contain a lot of fiber, they contain a lot of water and provide you with hydration, as well as minerals and vitamins. So you cannot really rule out all these fibers, and carbohydrates, and you can have them within limited amounts. And then the next diet I wanted to tackle was the detox diet. Now, believe it or not, you actually do not need to be taking fruits and juices as well as teas to detox. Your body, including your kidneys and your skin and your lungs, actually detox all throughout the day. Now, what you should be doing is having a balanced diet, making sure you get enough sleep and exercise, and you can, rest assured that your body will be doing all the detoxification you need for you. Now, a lot of these people rely on things like fruit juices or water fasts, thinking they will enable them to lose weight. What you are losing is a lot of water weight, but you're not losing a lot of body fat, which is what you want to lose eventually. So it's best to always follow a balanced diet. It's best to always follow a diet that's complete and includes all your macronutrients, your carbohydrates, your proteins, and your fats. Really hope you enjoyed this report, and we'll see you all next time.
And that brings us to the end of tonight's episode of Medical Talk. Back pain may be common, but with the right knowledge, lifestyle, and early medical attention, it's also preventable and treatable. Take care of your spine. It's what carries you through life. Thank you for watching, and see you next time on Medical Talk.